An 84-year-old man with a history of a slow heart rate who presents with dizziness and fatigue would typically need a pacemaker, but this story is different. So tell us about this 84-year-old man who presented with fatigue and dizziness and a history of an abnormal heart rhythm.
So he had been a long-term patient, and sometimes his heart rhythm would alternate between fast and slow rates. He also had some coronary artery disease, so a little bit of blockage in the arteries. And when he came to the office, he had just finished almost 3 weeks of antibiotics. He had been off the antibiotics for several days, but was having this intense, severe dizziness and fatigue. So when he was working in his yard, he became frozen, is what he said, and he couldn't do his regular activities around his house. And you had asked him a lot of good questions. Was his dizziness worse with, going from lying down to standing or with certain head movements? And he was denying all of that. He wasn't feeling lightheaded. He wasn't having chest pain or problems breathing. So he really felt pretty hopeless because he didn't know what was going on at all.
This is an interesting case because this patient presents with symptoms of dizziness and fatigue. And typically these are ways that cardiac patients will present, whether it's heart failure, but more frequently you see with heart rhythm abnormalities, particularly slow heart rates. And someone who's 84, you typically think of an individual who has their own pacemaker that's wearing out. So the heart tends to scar down in age, the electrical circuitry of the heart wears out. And these are individuals who present for a need for pacemaker. The heart conduction signals become slowed or abnormal. And so oftentimes you would evaluate this patient for the need for heart failure. However, after detailed questioning, there was one thing in the history that made us very suspicious as to the cause of his fatigue and dizziness, and we looked into that more closely. So, what was it in his history and presentation that suggested to you that this was probably not a heart rhythm cause of his symptoms, but something else?
So it was the temporal relationship of the antibiotic, because his symptoms started after taking the antibiotic and persisted afterwards.
So he started having symptoms when he was prescribed the antibiotics. So while taking antibiotics, became dizzy and fatigued. And even though the antibiotics were discontinued, his symptoms persisted. So what did that make you think of?
So the first thing that makes me think of is gut dysbiosis. So his microbiome is in a disarray and starting to cause systemic symptoms.
It's an interesting point you raised there, because many people do not realize that the GI system is a very complex system. And we have an ecosystem of healthy bacteria that actually helps us with digestion, but it also contributes to other physiological processes of the body, such as heart rhythm, mental clarity. So when the GI system is in disarray, you can have abnormal heart rhythm. So this individual who presented with fatigue, some perhaps neurological components, but also maybe slowing of his heart rate that may have contributed to the fatigue. It was our suspicion that it started from the GI tract, just based on the history of the antibiotic prescription. So we looked into this and we made our intervention based on this hypothesis. So how did you intervene with this patient?
We prescribed him grapefruit seed extract diluted in water, and this has very strong anti-pathogen properties. And we also gave him high-dose probiotics, prebiotics, and digestive enzymes.
Essentially, this approach was treating the dysbiosis because you have, on one hand, perhaps we were suspicious of an overgrowth of viruses, parasites, or other types of things, or Candida even, and then the suppression of the healthy bacteria. So treating with the grapefruit seed extract killed off the pathogenic organisms while supplying more of healthy gut bacteria and feeding that with the prebiotics. So it'd be interesting to see what the outcome was. So how did he do?
Well, after 1 week, the dizziness was gone. His energy was back up to normal. He didn't have any more brain fog.
Wow, that's impressive. So he didn't need a pacemaker, and you treated him with grapefruit seed extract and a probiotic, and within a short period of time, things turned around. So how do you explain this phenomenon in terms of him responding to this particular treatment with these symptoms?
Well, we know that the antibiotics also killed a lot of the good bacteria in the gut, and that allowed an overgrowth of yeast called candida. That overgrowth of yeast led to increased acetaldehyde production, which is a toxic product that causes dizziness, fatigue, and brain fog.
That's fascinating. It's really interesting because, this patient presentation gives you insight in terms of the art of medicine plus the science of medicine. And this patient came in with fatigue and dizziness, has a history of a slow heart rate. Had we been practicing just in a cookbook medicine fashion, he could have easily ended up in a cath lab getting a pacemaker and still having those symptoms. However, with careful inspection of the history and talking to the patient, it was pretty clear to us that these symptoms were related to the antibiotic use and not necessarily related to any other problem. And so the antibiotic use gave us a clue that the microbiome was abnormally affected. And we know that 10% of the population can have candida overgrowth. And so it led to a very straightforward intervention and a rapid reversal of his symptoms. So a very fascinating case. As always, I learn from these patients that we see here at Montgomery Heart and Wellness, and I hope you get a lot of this too. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.